Well, good morning, everybody. It's an honor for me today to introduce the governor of Kentucky, who has proven to be one of the truly great leaders in implementing health care in Kentucky and health care reform in Kentucky and many other areas. As you know, Kentucky has 2 Republican senators, 5 out of 6 Republican House members, and for the better part of 4 years, all they have gotten is misinformation and negativity about health care reform and the Affordable Care Act. In that atmosphere, Governor Steve Beshear made a very tough decision both to create our own exchange and to expand Medicaid, and we have been the absolute model for the country in how this has been implemented and the success that it has had, and I think the very, very optimistic portrait it paints about the possibilities for the Affordable Care Act nationally. So I'm proud to have him here today. Governor just addressed the caucus, was warmly received, and he is here now to answer your questions. Governor Beshear.
Thanks, John. Thank you, Congressman. First, let me thank Madam Leader Pelosi and all the leadership for letting me come up and talk with the Democratic House Caucus for a few minutes about a topic that's near and dear to me, and that's the Affordable Care Act. You know, Kentucky has become the gold standard when it comes to implementing the Affordable Care Act, and I'm very proud of that. We did it because we set out to do it, and we made up our minds to do it. We did it because our health statistics are some of the worst in the nation, and they haven't been that way just for a week or a month. They've been that way since they started keeping health statistics. And I knew that if we were going to make a transformational change in the health status of Kentuckians, we were going to have a transformational tool to do that with. And thank goodness the Affordable Care Act came along and gave me that tool. You know, we sat down, we planned, we did it the right way, we tested it, and let me tell you something, on 12:01 a.m. on October 1, when we opened up that website for folks to apply for health insurance, Kentuckians started swarming all over that website. To date, we've had over 550,000 visitors on that website. Over 180,000 folks have called the toll-free number of our call center. So far, we've signed up 69,000 Kentuckians. Now, that's at a rate of about 1,000 Kentuckians a day. We've had over 1,100 small companies who are in the process of getting insurance for their employees. So there is a tremendous pent-up demand in Kentucky for affordable health care, and to me that translates all across America. There is the same pent-up demand for affordable health care in the United States. People are hungry for it. They're confused about it, just as people in Kentucky have been confused about it because of the avalanche of misinformation that has been put out there by the critics of the act. But just like in Kentucky, when folks elsewhere get the information, they like what they find, and they will sign up in droves. The second thing I'm so proud of Kentucky for is we showed that the system can work and will work. We set up a simple website, no bells and whistles, and folks can get on there, they can browse, they can get all of the information they need, they can plug in their numbers, they can find out what they qualify for, and then when they get ready to do something, to open an account, they can go do that, and they can either get on our Medicaid program, which we expanded, or they can get a qualified health plan. Folks, you hear all kinds of criticisms about the act. It will never work. I have a U.S. Senator who keeps saying Kentuckians don't want this. Well, the facts don't prove that out. There's about 550,000 of them on our website right now who want it, and some 65,000, 69,000 that have signed up. So Kentuckians do want this. Another criticism, young people won't participate. Folks, 41% of the people who have signed up in Kentucky are under the age of 35. So young people are hungry for affordable health care, and they are signing up. Another criticism, business won't participate. I've already told you, 1,100 small businesses so far are in the application process, so that they can provide health care to their employees. You can't afford it. You can't afford to expand Medicaid, they say. Well, I'll tell you, when I first had to make that decision, I knew, number one, it was the right thing to do. It's the morally right thing to do. If there is a way, an affordable way to provide health care for every single Kentuckian, then we need to do it. But I had that question too. Can we afford it? What will this do to Kentucky financially? Well, I went outside and I asked some experts. I asked PricewaterhouseCoopers. I asked the Urban Institute at the University of Louisville. I said, go look at this for me and come back and tell me what economic effect this will have on Kentucky. They took about 6 months. And when they came back, they sat across the table from me, looked me in the eye and said, Governor, you can't afford not to do this, because it's going to, over the next 8 years, infuse about $15 billion into your economy in Kentucky. It's going to create about 17,000 new jobs in Kentucky. And it's going to have a positive impact on your budget of about 800 million jobs. So yes, we can afford it. Yes, this country can afford it. Because I'll guarantee you, if all of these other states who are saying they can't afford it right now will actually look at the facts and ask outside experts to go look at this, they will come to the same conclusion, that they can't afford not to do this. So my main message to the House caucus today was a message that's tough for folks to listen to when you have elections coming up, but it's simply this: be patient. Take a deep breath, because I'll guarantee you that by next November, this issue is going to look a lot different than it looks up here on the Hill right now. Because next November, the 80% of Americans who aren't affected by this at all are going to know that they're not affected by it. They're scared to death right now because of all the misinformation that's being put out there. But next November, they're going to know that the Affordable Care Act doesn't affect us. The other 20%, a good part of them, are going to have signed up. They're going to be very happy, because I'll tell you, Kentuckians that are looking and finding what they can get are extremely excited and happy about it. It's going to be the same way all over this country. So yes, this may be an issue next November, but I predict it's going to be an issue in favor of those who want to provide health care for every single American. Thank you.
Madam Leader. Please.
Anybody got a question?
Yes. Governor, do you expect, in Kentucky, McConnell has led the charge, at least up here, I'm sure in Kentucky, saying this is the worst legislation ever passed by Congress. Do you expect this to be a factor in his race for re-election in Kentucky?
Well, first of all, you know, I want to publicly invite our entire federal delegation to come back to Kentucky, as John Yarmuth does all the time, and come over to our center, our nerve center, where we're running this program, and see for yourselves what is going on. And when you see that, I think you will quit saying this will not work and Kentuckians don't want it, because they can see for themselves what is really happening. I think it may well be an issue in next November's Senate race in Kentucky, as well as races all over the country. But as I just mentioned, I predict that it will be an issue where people are going to start looking at the critics and saying, what was all that yelling and screaming about? I think you must have misinformed us about the Affordable Care Act. So we'll wait and see, but I think it may well be an issue.
Governor, the Kentucky experience seems to differ quite a bit from sort of the federal rollout of not only healthcare.gov, but the overall law. Is there anything the administration should be doing differently? Should they be looking more to Kentucky and to other individual states that have their own programs for advice on how to maybe right the ship?
Well, obviously, the rollout on the federal level didn't go well, and we all know that. But the thing that you got to understand is, even though it didn't go well, the law's here to stay, and we're going to implement it. So it's going to take longer than it would have taken if the rollout had gone very well. But, you know, they're repairing the website. You know, things have gone wrong in Kentucky before. I hate to admit it, but every once in a while they do. And as a governor, when they do go wrong, I step up, I acknowledge it, I take responsibility for it, and I fix it. And that's what the president's doing. He acknowledged that it was a mess, And he said, we're going to get it fixed. And they're getting it fixed. You know, it's up. It's doing much better today than it has been. It'll be much better next week and next month and 2 or 3 months from now. So this is a process. This is a marathon. It's not a sprint to implement this law. You know, the Medicare law that we passed in 1965, it took 2 or 3 years to work through all the kinks and get things settled in and for the law to really start working. And it's going to take some time for this because this is as major a transformation in health care as Medicare was.
I was asking whether you thought the 20% who stand to benefit from this will actually go to the polls and vote based on this issue.
It'll be interesting to see what type of election issue this is next year. Obviously, the critics right now, to divert attention from the dysfunction here and the lack of the ability to get things done, would like us all to be looking at the website and all of these other extraneous kinds of issues with the Affordable Care Act. But I have a feeling that by November of next year that this will be an issue, but it's not going to be an issue that most people are going to make the ultimate decision of who to vote for or who to vote against on, because I think the vast majority of Americans by that time will know that they're either not affected and so it's not a big deal, or they're getting happy and being happy because they're getting affordable health care for the very first time. But I think really next year that the focus is going to shift right back to the fact that we've got to start working together to move this country forward. I'm going to tell you what, Kentuckians and I think Americans are disgusted with the dysfunction here. I know this House caucus reaches out and reaches out and reaches out to try to find common ground and compromise, and if the other side doesn't do it, I think that will be the major issue next November.
One last question.
Leadership has said that they would stand tall. They expect Democrats to stand tall and run on the Affordable Care Act in November, in the run in November. Do you think that Democrats should run with the Affordable Care Act as part of their campaigning, as part of their objectives, like saying that that was a success?
You know what Democrats ought to run on next November? The idea that we want every American to have affordable health care. And the other side has had control of both houses of Congress and the presidency off and on for the last 30 or 40 years, and they've not done anything on that issue. And is the Affordable Care Act perfect? Probably not. But it is the first time that we have been able to step up and provide a mechanism that will actually allow us to get all of our people in Kentucky and all over this country covered by some kind of affordable health insurance. Here we are, the greatest country in the world, and we're one of the developed nations who still don't have that for all of our people until the Affordable Care Act came along. So I think it's going to be a plus next November. And if I were running for anything, I'd sure be running on it.
Governor Beshear, thank you. Thank you very much.
Thank you, Governor.